there, I'm Kaylee. I'm going to be your nurse today. Do you mind confirming your name and your birth date for me?
Maddie Jackson, 5'10", 2000.
Looks right. All right, I'm going to put my name up here on the board for you just in case you need me later. You know who to ask for. What brings you in here today, Maddie?
I just have a few moles I'm concerned about.
Okay. We'll take a look at those. So I would take her vital signs. I would take her temperature, her blood pressure, her respiratory rate, her heart rate, and her pulse oximetry. So I'm going to kind of do an assessment of your integument. Is that okay with you?
Yeah.
All right, I'm going to start out by looking at your hair. It's evenly distributed. You don't have any bald spots or anything. I don't see any bugs. It's a good blonde color and it's straight. It's not brittle or anything. It seems to have good moisture and the hygiene looks really good. Next, I'm going to be looking at your skin. Do you have any skin lesions under your clothing we need to be aware of?
No.
All right, I would note this little scar right here and that she has a few macules, but nothing looks good when I'm referencing to the ABCDE chart. It's a good temperature. It's got a really good texture. It doesn't seem too dry or too moist. It looks really good. And the hair is pretty uniform along everything. Next, I would look at her nails. They have a really good pink color. They're nice and round at the top. The thickness is really nice. When I pinch them, the capillary refills in less than 3 seconds. And I would also do so on her toe. I would pinch her skin just slightly to check her turgor. It returned normally so she doesn't have any dehydration or anything. And when I would ask her to put her fingers together to check their degree, they are not clubbed because they are less than 160 degrees. Other than that, everything looks really good. And is there anything else that I need to be worried about in your skin?
No.
All right, awesome. So I would document that and I would let the doctor know. All right, after doing the integument examination, I would look at her head, her ears, her eyes, her nose, and her throat. And I would start out by making sure that she didn't have any drainage or anything on her scalp, so that looks really good. It also did look good earlier when I was checking her skin integument. Her eyebrows and her eyelashes seem evenly distributed, and the hair growth there seems normal. Everything seems really symmetrical. I don't see any soreness or anything apparent. When I next checked her sinuses, does this cause you any pain when I do this?
Mm-mm.
And then her lymph nodes, does this hurt you at all?
Mm-mm.
Okay. And next I'm going to be looking at her cranial nerves, so do you mind following my eye? So her cranial nerves look really good in her eyes. Next, I'm going to kind of give a little bit further examination to her eyelids and her eyes. Everything looks really good. The iris and the sclera and everything looks normal. Pupil sides look normal. I would use my hand flashlight to check that it can dilate and accommodate and constrict. Okay. Next, I would look at her ears. I'd put her headband back and note that they look symmetrical with the line between her eyes, that there's no odd coloring or odor, that there's no sores or anything. And I would palpate her ears to see if there's any pain. Have you had any ear pain at all? All right, that's good. And I'm expecting the external ear and I don't notice anything out of the ordinary. And then I would use my ear light to check inside. Everything looks just fine. Her tympanic membrane's a good color and there's no inflammation or blockage. I would then do a hearing test by going behind her and saying a voice and checking to see if everything sounded okay. Then I would inspect the lips. She doesn't have any sores or anything like that. Do you mind opening your mouth for me, sticking your tongue out? Her tongue's red. Did you have something to eat
Yeah, I
earlier?
have candy.
Okay, you don't have any sores on the inside of your mouth or lesions. Everything looks really good. Have you had any issues with your mouth or your
No.
and your lips? You haven't had any crackling or anything? All right, that looks good. Do you mind smiling for me, frowning for me, sticking your tongue out for me once more? Everything looks really good there with her cranial nerves. Nothing looks swollen or anything. Have you had any issues like producing any tears or not having a lot of saliva?
No.
That's good. Her tongue looked really pink and good. It didn't look dry or abnormal. Once again, she had no sores. She stuck her tongue out so that cranial nerve is intact. Everything looks very symmetrical. And I checked her lymph nodes and you didn't have any pains here, correct?
Mm-mm.
All right, that looked good. Okay. Then I would do patient safety and I would put the bed rails up, put the bed on the lowest setting, give them the call light and show them how to use it. Red button's for me. Everything else is for the TV. She's not a fall risk, so I don't need to put her bed alarm on. I'd put her bedside table up, and then I perform hand hygiene once more. Is there anything else I can get for you? All right, thank you.